I really want you to take lower back pain seriously with your gymnast. And even though it's something that your gymnast can have a lot of, or it presents maybe a lot of the times, we really want to take that seriously. Coaches, if you have one random kid that has a spondy, it doesn't necessarily mean that you're doing anything wrong. If you have 2 or 3, especially within the same year, you're probably doing something wrong.
Hey everyone, welcome back to the NGA podcast. I am your host, Rebecca Grady, and I'm here with my incredible co-host,
Dr. Ian Kreider.
All right, so today we're going to break down another common injury in gymnastics, one that I've heard about a lot, and I obviously hear Ian speaking about it quite often, but I didn't actually know a lot about it until we decided to have this episode. So I'm really excited to hear what Ian has to say. And if you know this injury, you'll probably just call it Spondy. So today I'm going to pick Ian's brain about what that actually means, why it happens so often to gymnasts, and what coaches, parents, what we can do to help prevent it and maybe incorporate it into training programs. So, Ian, when people say Spondy, what does it actually mean?
Excellent. So there are 3 different diagnoses that start with the prefix spondy, and it would be spondylosis, spondylolysis, and spondylolisthesis. So the third one is usually the one people are talking about, the spondylolisthesis. The first one, spondylosis, that's just degenerative changes that happen over time. We're not going to see that in gymnasts, hopefully. That's usually more in as you gain more life experience, you'll start to see things like that, right? As you get older.
That was so nice of you. As you get older, like us.
That's right. Then you have spondylolysis, which is usually a unilateral fracture, meaning a fracture on one side of the spine, but there's been no slippage of the vertebrae. And we'll talk about what that means.
Okay.
And then the last one, spondylolisthesis, this is the more severe one. And this is where you absolutely have a fracture on both sides of one of your lumbar spine segments. I guess it technically doesn't have to be lumbar spine, but that's where you see it all the time, right? L5, S1, L4, L5, these are the most common segments for you to see these fractures at. And you just get a fracture basically in the part of the bone that attaches to the joint. And so then if it's fracture on both sides, you literally have no bone attaching it to the next bone. And so all that's left that's holding it, it would be soft tissue, muscle and ligaments and things like that, and the disc. And so what can end up happening over time with this bilateral fracture is that the top vertebrae can start to slide forward on the bottom vertebrae, and those are graded 1 through 5. Okay, so 1 is a little slippage, 2 is a little bit more, 3 is a little bit more, 4, like 5 is like your vertebrae hanging out in your stomach kind of thing. So we don't want that. And there's lots of things that go with it, but that's the basic definition of the difference between the 3 diagnoses. And what we see with gymnasts most often is that third one.
So, is this something that develops over time usually, or does it happen with one big incident, or what am I trying to say?
Traumatic accident.
Thank you.
Yeah.
One traumatic accident that happens in the gym.
So it can happen through trauma, but most often it happens through repetitive hyperextension of that joint. So hyperextension meaning bending backward and going further backward than what you're really supposed to go.
Okay. And I'm guessing that happens in gymnasts because they're always bending backwards.
It does. It's common in gymnasts. It's actually common in football, especially with linemen, because they're always reaching up and extending their back to block.
Okay.
It happens in hockey players a lot too, because they're always leaned forward to skate, but holding their chest up, so they're always in an arch, and they get hit in that position as well, and cause that hyperextension. So you see it in multiple sports, but gymnastics is known to be probably the most common.
So in gymnastics, is it more of like the type of movement they're doing, or is it the volume of repetition? that's going on?
It's probably a combination of 2 things. So it's definitely a volume of movement. You
Okay.
know, the average person bends forward 4,400 times a day, and we bend backward like 3. That's not an official number. The first one was, but the bending backward one isn't an official. But we just don't bend backward that often, right?
Right, yeah.
You know, you give it one of these things in the morning, and if you see a cool cloud, you might bend backward again. But that's like about it. We just don't bend backward much, but we bend
Right.
forward all the time, right? Every time you go to brush your teeth, every time you go to, for women, every time they lean forward and put on makeup, every time you wash your hands, like every time you bend over to tie your shoes or put on your pant, right? We bend forward all day long. We just don't bend backward that often. So gymnastics, of course, does have more bending backward than the average person tends to do throughout the day. But the second thing that we see is that gymnasts will get tight in either their hips and or their upper back, and because their upper back or hips are tight, it puts more force on that lower back and causes it to work harder and take more of the
Okay. So, do growth spurts also play a role in this?
Sort of, kind of. So it's not the same as something like Seaver's disease or Osgood-Schlatters disease, where you
Okay.
have it's truly a growth plate related injury where the growth plate starts to get separated or irritated or inflamed. That's not what we have here. We don't really have a growth plate in this area. The bones obviously grow, but there's not like a true growth plate like what the arm would have or
Yeah.
the leg would have. So it's not a growth plate related injury, but it does seem to happen during times of fast growth, just because their things are getting tight and they're just more likely to get injured in the first place. And so we see that injury happen. I've seen the injury in younger athletes, like as young as 9 or 10, which
Jeez.
is always a little upsetting when you hear about that and you really try and figure out what happened. But most of the time, it's happening in our teenagers after
Okay.
they're done with their growth and after they've just kind of gotten used to their body but stiffened up a lot in their spine. That's when we typically seem to see it.
And is there a certain time of year that you usually see this? Or is this something that kind of
Mm.
presents itself all over?
No, that's going to depend more on the programming at the gym than it is
Okay.
going to be depending on the season. Yeah.
That's kinda what I figured. So before we get into programming and what coaches are hopefully doing in their gyms to help prevent this, what are some of the early warning signs? What do gymnasts usually complain about? Is it usually based on a specific skill? Is it come and go? What kind of complaints do you normally hear?
Yeah. I typically hear, obviously, lower back pain, right?
Yeah.
But it's usually lower back pain with repetitive extension or with really hard, like impact landings. So you might have a gymnast that is just super powerful and they don't really do very many bendy skills. Like they're not doing a back handspring on beam, but they do like double backs or double pikes on floor. And
Okay.
every time they land, man, their back is just not feeling real good about that. So it's usually one or the other. Eventually, it's both, but at the beginning, it's usually one or the other. And it's more likely that they're going to have pain with that hyperextension and just, after they do a couple of back walkovers or after they do a couple of back handsprings, they're sitting there holding their back, or they go over there and they tuck and roll out their back, or they hop on a foam roller and just try to make it feel better. And that's typically what I see first. Now, at
Okay.
that point, it doesn't mean that it's fractured. Doesn't mean that they have a broken back, but it could mean that they're on their way to that. So I really want you to take lower back pain seriously with your gymnast. And even though it's something that your gymnast can have a lot of, or it presents maybe a lot of the times, we really want to take that seriously and not have lower back pain with our gymnasts.
Yeah.
And I'll say this with coaches: if you have one random kid that has a spondy, it doesn't necessarily mean that you're doing anything wrong. If you have 2 or 3, especially within the same year, you're probably doing something wrong.
A
And
training
it's
program.
yeah, it's a blunt thing to say, but it's got to be said because I see that happen a lot, and that goes with any injury, right? If you see the same injury happening in more than just one kid, especially within the same year, you're probably doing something wrong with your planning and programming, and something needs to be adjusted. But if you're just see one and you're like, man, this is the first time we've ever had a spondy and I've been coaching for 10 years and no one else is complaining of back pain. It could be something genetic for that kid. It could be the skill choice for that kid that you just maybe it kind of was your fault, right? But
Yeah.
it could just be a skill choice issue where they go, oh, yeah, they're doing back handspring on beam, and they're also doing pack saltos on bars, and they're also doing your chinkos on vault, and they're doing front handspring, front lay on floor. And you take a step back and go, oh, shoot, we've been event coaching and we haven't been talking to each other and they've been working these archie skills every single day and we just didn't realize it, right?
So they're
And
just doing
that's
a lot of numbers.
yeah, that's just an honest mistake that can happen, especially if you're not coaching every event or a part of coaching every event. Then that stuff can happen. It can creep up on you really easily. But for the most part, one random kid, it probably is random. But if you have two or three kids, you really need to stop and take a look at your planning and programming and go, okay, are we arching too much or are we arching too soon during practice? And what I mean by that would be as part of our warm up, are we doing Archie things before they've even had a time to stretch their back? It'd be like as part of your warm up, you do handstand walks, but they haven't stretched their wrists yet. Every kid is going to be going, oh man, my wrists, right? And they're going to
Mhm.
be kind of rolling them out and rolling them around, and they're probably going to be sore the rest of the practice because you did, a whole bunch of handstands and handstand walk stuff before they got to stretch their wrists. And so, as part of your warm ups, if you're doing standing back handspring step outs and they haven't had a chance to stretch out their back yet, yeah, it's probably going to be sore.
Yeah. So, do you have specific stretches that you think warm the gymnast up the best?
Yeah. Well, one, I view a bridge not as a stretch, but as a skill.
Okay.
Or a drill for a skill. And what I mean by that is the kids that need a better bridge, when they do a bridge, they don't get much stretch out of it, right? They're sitting there with their arms a little bit bent or their legs a little bit bent, and they're just fighting to stay up,
Mhm.
right? They're
Yep.
they're they're not getting anything out of stretching that bridge. The kids that don't need to stretch their bridge any further can stretch a bridge really, really far and get some, quote unquote benefit from it, or at least feel some stretch in it, right? Those are the kids that they pop up and they can straighten out their legs and they can press their shoulders past their hands 2 or 3 inches. And they're like, oh, that feels so good. And you're like, that seems excessive. I don't know that you need all that much, right?
Too bendy.
It seems like a lot of bend, and so I don't use a bridge as a stretch, but I do use it as a skill. So I'm not saying that I never do bridges with my athletes, but what I am saying is that I do other stretches during warm-ups, and then the ones that need bridges, especially compulsory gymnasts, then they pop up and they hold bridges and they show the position and they do it correctly and they learn how to kick over and they do handstand bridges and they do all those things just like any other gym does. But we
Mhm.
may not stretch a bridge as a stretch during warm-ups. Yep.
So what do you do before that?
Yeah. So instead, I'm trying to stretch kind of the three parts of a bridge. So I'm trying to stretch their hips, I'm trying to stretch their lower back, and I'm trying to stretch their upper back. Most kids don't have tight shoulders. Even if their shoulders look tight, it's almost never actually their shoulders. Probably should figure out how to count this one day, but I've done probably over 1,000, if not maybe close to 2,000 assessments on gymnasts where I just go head to toe, anything too loose, too tight, too weak, any of that stuff.
Mhm.
And what I have found is that most gymnasts that look like they have tight shoulders, their upper back just isn't moving well enough. And because of that, their shoulders can't move well enough. As we
Oh,
loosen up their
interesting.
upper back, now they can move their arms just fine.
Okay.
And so I always start with upper back. I never start with stretching shoulders because if you're going to try and stretch both, the shoulder will always get stretched because it's the easier joint to stretch. And so, the human body kind of chooses the easy way out every time. And so if you're trying to stretch both, like let's say you put your arms on a block in front of you and you press your armpits down towards the ground,
Mhm.
technically you're getting some arch in that upper back, but you're also getting lots of shoulder flexion. And so you're going to stretch the shoulders. You're not going to stretch that upper back. I want to do things during warm-ups that stretch each part. All of your split stuff stretches hips really well as long as they, stay square and all that.
Which
Uh,
is not always often.
which is maybe not always happening, but you're getting plenty of hip stretch by doing splits if they're doing it correctly. Then I typically do repetitive seal stretches, laying down knuckles of your hand underneath your shoulders. and then pressing up off the ground into that whatever cobra, upward facing
Yeah.
dog, seal
Hold it, or
stretch,
do you
whatever.
like, is it the movement?
Yeah, so we go up, we breathe all our air out, and then we go back down. And then we go
Okay.
up, breathe all our air out. So it's like a
Ooh.
2 second-ish hold. Yeah, so I don't do it because of the breathing, because of your version of breathing,
I
but I do it because when they breathe out, their hips will sink down just a little bit further and they'll get
okay.
just a little bit extra stretch. Because gymnasts tend to squeeze things when they're not supposed to squeeze things, and then not squeeze things when they're supposed to squeeze things. But, that's a different matter. Uh, but they tend to just they'll like squeeze their butt and they'll squeeze their abs as they do these press ups. And I need them to breathe out to relax everything, relax their butt, relax their hips, relax their stomach, and
Mhm.
allow that to actually stretch. Then for upper back, for warm ups, I'm typically just like linking their hands on their stomach and just doing shoulder blade squeezes, where they're just squeezing those shoulders back as far as they can go. If we're actually trying to mobilize that upper back, though, I get them over a foam roller or a low beam or the edge of the tumble track or whatever, and I put their hands behind their back, have their elbows go in, and then they just lean back over that foam roller across their shoulder blades or that low beam across their shoulder blades as far as they can go.
Okay, and do they hold
Yep.
it, or is this another thing that
Same
you
thing,
kind of
just repetitive. Because
repetitive? Okay.
especially when we're trying to move joints, then we need to do it repetitive. Joints
Okay.
don't respond well to static stretching.
Okay.
Yeah.
And one more question about hips. If let's say they don't square up, what's another hip mobility thing that you can do for
Yeah.
stretching?
Yeah. Well, even if they don't square up in their splits, hopefully we're doing some sort of split prep stretch
Yeah,
where they're in a lunge and they're pressing the hip
the
forward.
hips
When they're
forward,
in
yep.
that bent knee lunge, it's pretty like not impossible, of course, but it's fairly hard to come unsquared during that.
Yeah.
Because they have to have that back leg turned pretty straight in order to just do it correctly and stay balanced and
Mhm.
all that. So that's pretty much all that I would need to do. If you
Okay.
need a little bit extra hip flexor stretch, then hop in that bent leg lunge, kneeling lunge on the ground, and then kick the foot out. And by kick, I mean just like rotate the foot out away from midline.
Okay.
Yeah, and then press the hip forward. So you're actually rotating the hip in, but kicking that foot out and then pressing forward. And that will stretch on the outside of the hip. It'll stretch a really specific hip flexor called the TFL or the tensor fascia lata. Not latte, but
It should be latte. It'd be cooler.
that'd be way cooler.
I know. Okay.
Tensor
So,
fascia coffee.
all right. So and then lower back. Did we address that?
Yeah, that was the seal stretches.
Oh, yeah, yeah, yeah. Okay.
Yep.
Still stretches. Then you said spondy can happen from muscle tension. So stretching goes with that. But do you have to do any conditioning to strengthen certain areas too?
Yeah. When I have a gymnast that is tight and they're using their lower back too much. And one way that you can see this is actually a bridge. So you have them pop up in a bridge. And instead of seeing this nice rounded arch where they're using their entire spine, you
Hmm.
see really flat upper back or kind of these really tight hips. And then you see this acute angle in their
Yeah.
lower back. And it's this hinge point. If they're going to fracture their spine, I guarantee it's going to be right there. Okay.
Okay.
If it's because of overuse, right? Because that's the part that's having to bend too much too often.
Okay.
And so instead, we need to get them to arch their entire back. So there's we'll call it 3 steps to doing this, right? So step one is they need enough range of motion to be able to use their whole spine. So if their upper
Hmm.
back is tight, doesn't really matter what conditioning you do or what technique you give them or anything like that. They won't be able to do it because they don't have enough available range of motion. So we want to make sure that their whole spine and hips move like they're supposed to. Then step two would be training them to actually use the new range of motion. Things like I call it like the WTs, Ys, and Is, where they lay on their stomach, make a W
Hmm.
with their arms, and pull up off the ground, make a T, make a Y, make an I, and same thing, just pulling it off the ground, trying to use that upper back a little bit more. You can do stuff like wall angels up against the wall. You can even do stuff like slow arch hollows on hanging from a bar, where they're really trying to open their chest on the arch and they're trying to round their chest and get hollow through their chest and back for their upper back. And so that teaches them, hey, I have this motion and this is how I use it. And so So that's kind of step two, is teaching them how to use that range of motion. It's
Yeah.
not truly strengthening. They're plenty strong, probably. They just don't know how to use that new range of motion that they've obtained. And
Okay.
then step three would be, now let's incorporate it into actual skill work. And so when they're doing giants, are they tapping with their whole spine, or are they just using their hips and lower back to tap? When they're doing even something like a Takachev, when they're doing a Takachev, when they hit that bridge, is it just their lower back with their head in, or is their head out and they're using that entire back in order to hit that good bridge shape? When they do a Yurchenko, right? When they do a Yurchenko, are they reaching with those arms, or are they just keeping their arms tight and hinging with that lower back
Mhm.
in order to hit that shape? So I want them to use the whole spine in order to protect the lower back.
Okay.
Yeah, and this is all pre-Spondy diagnosis stuff. If they've been diagnosed with a Spondy, they just need to go see somebody. Like, they need to go see PT, because it can result in surgery. I've had gymnasts before that have come to me for like return to sport programming,
Mhm.
that have had spondylolisthesis. It had slippage, so it was probably like a grade 2-ish, hopefully nothing more than that. But then they had to actually have a fusion surgery. And so, they had to have the disc removed, they had to have bone put in place, they had to have screws and plates and all the things. And now that segment will not move, right? Because it's all fused together.
So when a gymnast has all of that fuse, they have to go through that surgery. Is it possible for them to go back to gymnastics? And if it is, what kind of changes do they usually have to make when it comes to how they perform now versus what they used to be able to do?
Yep. Yeah. So I've had, I think, two gymnasts so far that, not my own gymnasts, but two gymnasts that have come to me for PT help. They've already gone through the PT, but they came to me like, hey, I'm technically cleared to start gymnastics again. I've had this fusion surgery. I'm a level 10. The doctor said to just go back slow and try and avoid arching. What on earth do I do? Right.
Just avoid arching.
Yeah, yeah. So that's when we come up with a plan, and it's usually full of compromises, right?
Okay.
Where we go, hey, you've done your Chenkos for the last 6 years. I'm probably not going to switch you over to Soups then at this point,
Mhm.
right? But if we can get rid of your back handspring on floor and your back handspring on beam, so we can get rid of those back handsprings that you'd be working every day and then still do the Yurchenko, I'm more okay with that. So even with the fusion surgery, even with the spondylolisthesis that is completely pain-free after appropriate rehab and rest and healing time and all that, even with those diagnoses or those issues, I usually don't eliminate all backward bending. We try and eliminate as much as possible to keep
Mhm.
them safe, because we know they're at risk for doing it again. And so we try and eliminate some, but probably not all of it. But if we can make these concessions in certain places, then I think it's going to keep them much safer. And yeah, I've had gymnasts that continue on with NCAA gymnastics after fusion. So yeah, it's certainly
Like,
possible.
yeah, promising to
And
hear.
yeah, and as they go, like this one, I usually hear from her like once a year or so, and like, hey, so my coach wants me to do this. Do you think I can? And so we'll sit there and we'll talk through it, and
Yeah.
talk about how her back's doing, and also those sorts of things.
Yeah. Can you talk about how long the recovery process can take? I think maybe being able to hear the levels that they have to go through when it comes to physical therapy, maybe that can encourage coaches and people to probably incorporate more of this prevention into their programming.
Yeah. So the protocol for, I have a diagnosed spondylolisthesis, but not bad enough for surgery,
Okay.
which means basically that it's just stable. So, meaning that, like, for instance, some physicians will do like flexion extension x ray. So, they'll take an x ray of you standing there, they'll see the spondy, and maybe it slipped a little bit. Then they have you bend forward and bend backward, and they take x rays at each position and see if it slips more. If it slips more, then there's an indication there that it might be an unstable spondylolisthesis, and it might need surgery to repair that because it's moving too much. Whereas some people have that slippage, but it's completely stable. It doesn't move, and they can become pain free and still have that slippage and go back to gymnastics, and it never really bothered them again. So the human body's pretty wild. It does some amazing things.
Yeah, that's
Uh,
crazy.
but so this would be kind of the protocol for, I have a spondy, but I don't have to go through surgery. The protocol there is minimum 8 weeks completely off from gymnastics. We might do like some upper body, lower body conditioning. We're probably not going to do any true core conditioning. In PT, you might do like some core stabilization stuff, and I have my own opinion about that thing.
Yeah.
But you might have some core stabilization exercises that you're doing, but you're not doing V ups and arch ups and that sort of thing. We got to let it rest and heal. I'll also say that not every spondy completely heals. If there's a slippage and there's enough of a gap in between the bone, it won't fill in that gap with new bone. And so the fracture won't heal.
Okay.
But you can still become pain free and go back to gymnastics without complete healing. And that's why most doctors that I've found, they don't do a follow up x ray at 8 weeks or 12 weeks. And that's because as long as you're pain free, because that's the gauge. It's not necessarily the image that's the gauge, which is nice because if they went off the image, you'd never go back to gymnastics again because you would always have
Right.
a fracture there. Yep.
So for someone who came into to this not knowing anything about this, I would have assumed core exercises would have helped with stabilization. So what happens if this is going on and instead of going to PT and trying to figure out what to do, let's say gymnasts, they're like, okay, let rest, but I still want you doing core. What would that do to
Yeah.
the injury?
Yeah, so it would just keep it irritated the
Okay.
whole time, right? So if you don't let it rest, it would just never heal fully. Whether
Okay.
that means pain-free or actually bone fracture healing, it would just never have the opportunity to heal if you were just still doing lots of core, even though you weren't doing gymnastics, if you were just doing lots of core strengthening stuff. They've
Gotcha.
got to get pain-free. And so, yeah, because 8 weeks is the minimum amount of time, and usually 12 weeks is about the maximum amount of time. But
Okay.
at 8 weeks, if you still have pain, most doctors are going to put you out for another 4 weeks and it's going to be 12 weeks out of gymnastics. And that's a
Gotcha.
long time. You spend
Yeah.
3 months out of gymnastics and man, you feel a little rusty coming back for sure.
Yeah, I'm
so
sure.
so we want to do it right. We want to make sure that we're super conservative when we need to be, and then super aggressive when we need to be. And what I mean by that is as soon as you're pain free, then we start doing some really aggressive stretching of the upper back and the hips, like we talked about, right? Where
Right.
we want this thing, but this is more PT guided versus, hey, your back is tight and your bridge looks a little wonky, and but you don't have anything wrong with your back. Let's just work this in the gym. Go for it. But if they actually have pain or if they've been diagnosed with a spondy, they need to see a PT. And because as coaches, your insurance liability coverage does not cover you for treating pain, right? And so if you're trying to get a gymnast out of pain by doing certain exercises, then you are now acting like a physical therapist or physician or something like that. And your gym's coverage does not cover you to do that. So if they're in pain, they need to see somebody that actually has a license and has been trained to help with that pain.
Yeah, and I'm sure there's not very many gymnastics coaches who know exactly how to help an athlete through something like this.
Right, right. Yeah,
Yeah.
there's few enough gymnastic specific PTs out there anyway. I think I can think of 5 or 6 that I know
Yeah, I
of,
remember you
right?
saying that. Yeah.
That truly just treat gymnasts. There's plenty of ex-gymnasts that have become PTs, but they haven't jumped right back into gymnastics and
Yeah.
just treated gymnasts. Yeah, so there's very few out there that know anything about gymnastics, and most of those people aren't doing crazy stuff like me and still trying to coach at the same time.
Right.
So
So, big thing to know, it's not just about resting this injury, it's about also fixing the mechanics and how it's used, because that's kinda what it seems like is a lot of what you're doing with them is teaching them how to use the body parts that they need to be using
yep,
to do their skills.
yep,
Okay, so let's talk about programming.
yeah.
So, what should coaches be doing for, them not knowing all the stuff that you know? What should we be programming in? When should they be emphasizing certain areas?
Yeah.
Break it down for us.
Work it, work it. All right. Anyway, so, uh,
Uh,
golly, it's terrible. Okay. Anyway,
it's the favorite moments, though.
yep, for sure. Okay. So planning and programming. First, you have to have a plan. If you don't have a plan, you're going to cause injuries in your gymnast, or like at least you're just not going to hit goals like you want to hit
Mhm.
because you don't have a process of obtaining that goal. So just like we've talked lots about gymnasts having processes to get over mental blocks and fears and that sort of
Yep.
thing. Like you're not going to meet a goal unless you have a process on how to meet that goal. So
Mhm.
you have to have a plan and you have to stick with that plan until you realize that it's not working and then you can switch it up. especially like the next year when you go, hey, we tried this plan and it worked pretty well in this area and this area, but we need to change it over here. So you've got to have a plan first and foremost.
Yep.
Secondly, you've got to have a plan if you're talking about skill work that doesn't overuse a specific body part. So if you're talking about, we're wrapping up season, especially probably by the time this podcast comes out, season that will be super close to wrapping up, and if it's not already. And so we're talking about summer training then. Well, with summer training, do you need to do hard landings every single day, for all summer? Yeah, hopefully not. Now, I will say up until the last like year and a half at my gym, we didn't have a pit landing for floor. Then finally we were able to switch some stuff around on vault, and now we can move a vault out of the way and air track tumble into the pit. And so we can have a soft landing on floor. But prior to that, it was hard landings on floor or tumble track onto resi, and that was it. And
Yeah.
so the girls really didn't get much of a break, but they were still okay as long as you plan things out appropriately and you didn't do hard tumbling every single day. We want to make sure things like that, right? Or if you do know that you've got some upper level gymnasts that are at like that level 8 to 9 phase where they're doing lots of backward bending acro on beam, and they're doing Yurchenkos, and they're doing pack saltos or Takachevs or Jaegers, and they're doing front handspring front lay or round off whip half front lay, or they're doing things that involve lots and lots of arching.
Hmm.
If that's the case, you just have to make sure that you go, hey, you don't get to work acro on beam every single day. Like some days are leap days, and some days are leaps, jumps, and turns day. And then some days are dismount day, or some days are acro days. But we don't get to work that acro every single day if you're
Yeah.
also working all these other archy things as well. And we're also watching numbers too. So not that my gymnasts obey it by any means, but my rule, our gym rule on beam is you get 10 of anything that you're working, right? And it's, if they would just stop and think about it, and I've tried to get them to realize it, but teenagers are kind of stubborn sometimes.
Yep.
Uh, so if you stop and think about it, like let's say you are able to do your acro skill every single day of beam, and you do beam 5 days a week because you're, trained in that 18 hours a week or whatever, right? So you're doing beam 5 days a week. You get to train acro every day. If you just do 10 every day, that is 50 by the time the week is over, and that's 200 or more by the time the month is done.
Hmm.
Surely you can get your skill in a reasonable amount of time doing that type of skill work, right?
Hmm.
And then what that also does is you go, all right, if I get 10 back handsprings on beam before I need to move on, and then let's say I move on to aerials after that, you're going to have time, right? And how long should it really take to do 10 turns of back handspring on beam, right? I don't know, 7 minutes, right? Maybe 10 minutes, something like that.
Yeah.
If you do like two every time you hop up, you could get it done in 5 minutes for sure. And then you have, 40 more minutes of that rotation, let's say 30 minutes if you did a long complex or something beforehand, but you still have time to work other things. And my goal for my gymnasts for upper level gymnastics has always been get as many skills as you can, and then let's choose the ones that work best for you.
Yeah.
And so if you can learn, best case scenario, right? You have one of these awesome beam workers on your team, and they just learn every single skill that you can learn for as far as acro stuff goes on beam. And then you go, all right, well, what gets me the most bonus? What looks the best? What gets the least amount of deduction? And then you just get to choose. And so if you work a big variety of skills with lower numbers, then they get to really find out what they're good at, and you keep them safer as well.
Hmm.
And so it's a win-win all around. So we want to watch numbers, we want to watch frequently used areas, and we want to watch the impact on those areas,
Hmm.
right? Because a front lay on tumble track is not the same as front lay on floor. And so the more impact, the less repetitions we try and do on those.
And I would agree with that when it comes to any of my kids who have anxiety or mental blocks. It's like they
Yeah.
try to push through the numbers or push through the anxiety, I guess, with numbers.
Yeah,
And
yeah,
I'm like, no, because you're not thinking anymore. So coaches out there, if you are having any kids that you know that have high anxiety, they're blocking on a scale, watch them particularly because they will I've had some of them tell me they've done over like 20 of that skill when they were on beam that day. And I was
yeah,
like, whoa, not good. Let's not do that.
yeah. I've had them do higher than that. They're like, "Oh, well, today was just a really good day for my back walkover, so I did 45 of them." I'm like, "Stop it. How's your back feel?" They're like, "Oh,
No.
terrible." I'm like, "Of course it feels terrible. Stop
It's
doing things
terrible.
like that."
Yeah. Yeah. Remember, low numbers and then purposeful.
Yeah.
Focus on what we're
Yep,
doing.
absolutely.
Okay, so is there a certain time of year? I know you were saying summer, it gives you that time, but how should we be doing this? How do we remember to do it throughout the season?
Yep. Yep. Again, have a plan first because
Mhm.
without a plan, you're going to overdo it. It's just natural, right? You're going to go, "Ah, all right, one more, or why, just go like just two more routines on beam and then we'll call it quits for today, right? Or we're going to stay here until you make a beam routine or
Right.
something like that, right?
Yeah,
Um,
that's not
if you if you don't have a plan, then you're going to fall victim to those traps and those thought processes. And so instead, we need to try and have a plan of going, hey, we're going to do this many routines. You don't have to do routines every day of season to be successful. Okay. Now, if you want to be at your peak the very first meet of the year, and somehow try to coast the rest of the year without injury, well, then you're probably going to have to do a ridiculous amount of routines every single day to make that happen. But that shouldn't be the
sounds
goal.
awful.
Yeah, sounds awful. Yeah, that
Sounds
shouldn't be
so
the goal.
worried.
Right. Now, should they be prepared at the beginning of season? Yes, but should it be their best meet? No. Right? That would be weird if it was. If it was, it means that they just weren't ready for the next level or something, and you had to hold them back a year. And these routines are super easy for them. And if
Mhm.
that's the case, they're still probably not doing a ton of numbers, right? And that's okay. So routines don't have to happen every single day of season. On the off days of routines, make sure they're, doing things that support recovery, make sure they're doing things that are training up that maybe don't involve the same skills that they've been doing in their routines. I know that's not always possible. They have to work problem areas on their off days as well. But we want to make sure that they're not doing routines every day and that we get a variety of skills in their days that they're not working routines, especially skills that work end of range of motion, like a back walkover, where you're like, that's as far as that gymnast can bend when they do a back walkover. We don't want to do lots and lots of those, right? Whereas like a tap swing, yes, they arch their back, but they're probably not going to their full end range of motion in a tap swing, right?
Yeah.
Maybe on a front giant tap, but not on a regular tap swing. So if they're using their full range of motion on something, then we want to back off and keep lower numbers. If they're not using their full range of motion, then we can probably do a little bit more, right? Like a handstand isn't full range of motion for their back. If we're concerned about the back, they can do all the handstands they want to do. Right. We can talk about wrists another time.
Okay.
But if we're talking about back, right, they're just in that nice neutral spine. So it shouldn't be an issue for their back to do lots of handstands.
Yeah.
Yep.
Is there anything that coaches should be focusing on in postseason when we cut routines before we start really training up and
Yeah. Give them a break. So my
not what I
compulsories,
expected?
yeah, my compulsories are going to have a week off after season is done. My optionals have 2 weeks off after season's done. And I know right now parents and coaches alike are going 2 weeks off. It's crazy, but man, they need it. At
Mhm.
the end of season is when they're most stressed out, not just because of their gymnastics, which is surely physically, mentally, and emotionally stressful to compete all year long, right? And get these routines done and try and get skills for the next year, all that. But also during their championship time, regionals and nationals, that's when they're under the most academic stress as far as
Yeah.
final exam time and benchmark exams or end of year exams for even the little ones. And they probably got behind on some projects. They probably got behind on some homework and some studying. They need some time off. And I know everyone is so excited. Like I am the same way. As soon as season done is done, I'm like, let's get in the gym. Let's work new skills. I'm tired of watching routines. Like everyone is so
Let's have
excited. The
some
kids,
fun.
yes, the kids are excited. The coaches are excited. Everyone's excited to get in the gym to work new
Mhm.
skills. They will be just as excited after a 2 week break or
Yeah.
1 week break as they will immediately after nationals or after regionals or after state meet. So we want to make sure that we give them some time off. That way they can heal and recover and be mentally prepared for the next season or for the next training cycle. So
Yeah.
time off is probably the most important thing. And then we need to cycle through some strength training, some power training, some endurance stuff towards the end of summer to get them ready for routines again. But we just want to make sure that we create really strong and adequately flexible gymnasts. So they need to be as flexible as they need to be. and they need to be as strong as possible. With those two things mixed together, it's much, much harder to get injured.
Okay. Sounds good. Is there any final takeaway that coaches should be, or parents, I
Uh,
guess, when it
yeah.
comes to this?
And final takeaway is take pain seriously. If they're having
Uh,
back pain, let's get
Like,
it
believe
figured
them.
out. Yeah, believe them, get it figured out. At best, nothing's wrong. They can get back to it.
Yeah.
But at worst, some really bad things can go on and like career ending things can happen. So we want to make sure that we address back pain quickly. And if it's random, it happens one day, pay attention, but that doesn't mean you have to run and get them x rayed. But there's some consistency to it. And if there's a pattern to it, then we start to go, all right, yeah, let's go get that checked out.
Yeah. I agree. Okay. So this isn't just something we want to work on for weeks, is what I'm getting from you. This is
Yeah.
a whole year round kind of thing that we need to work on for protection and, taking care of our athletes. I've also helped athletes through recovery when they're like 10 years old, going through these back issues. So trying to do this and program it in, I think would be so beneficial for especially making longer careers in the sport. So
Mhm.
anyways, Ian, thank you for walking us through this today. This is definitely one of those injuries that comes up a lot in gymnastics, and I actually am so excited that I know so much more about it now. So hopefully this episode gave everybody who's listening a better understanding of what we call a spondy. I'm not saying the real word. And why it happens and what can be done to help prevent it in training. So if you found this episode helpful, feel free to share it with coaches or parents who could benefit from the conversation. So thank you for listening. And until next time, stay happy, healthy, and high performing.